Welcome to Breaking Through with me, Kristen Rao-Finkbeiner, powered by MomsRising. We have a really important show for you again this week. We start out talking with Dr. Jack Turban about their new book, Free to Be, and about how to actually bust the myths that are being put out there through disinformation about the trans community. After that, we look into what's happening with the WIC program. That's nutrition for women, infant, and children, and how you can help make sure that does not sunset. And we close the show with a recent update on access to reproductive health care. We're going to jump right in with our first guest. Welcome back to Breaking Through with me, Kristen Rao-Finkbeiner, powered by MomsRising. We are joined right now by a very special and important guest, Dr. Jack Turban, who is an author and an expert. Welcome.
Hi, thanks for having me.
I'm so glad that you're on. Can you share with our listeners a little bit about your most recent book or article that you authored that everyone should know about?
Yeah, so the book is called Free to Be: Understanding Kids and Gender Identity. And it's structured by telling the story of three trans kids from really early childhood until young adulthood, so you can follow along on their journey. And as you follow through, it teaches you all of the science, medicine, and politics of gender identity to help people understand trans kids better and also be able to have informed conversations about the political debates and all of what we're seeing in the news lately about trans kids.
There is a lot of misinformation, disinformation, non-information, full-out lies, ridiculousness floating around right now. What are the myths that you would like to see busted immediately everywhere?
Yeah, sadly, there are so many, it's sometimes hard to pick. But, one thing that's happening right now is the US Supreme Court just took up a case that's examining whether or not conversion therapy bans should go away. So there's this idea out there that conversion therapy for trans people is not dangerous, or that it's a good idea to try and force trans people to be cisgender, despite tons of research showing that that's linked to bad outcomes, including suicide attempts. The United Nations recently reviewed all of that research and called for an end to the practice worldwide. But as you've mentioned, we're living in an ecosystem where there's just so much misinformation out there, and the peer-reviewed science isn't getting to people. So that's one really kind of urgent piece of misinformation that I'm worried about. There's also this idea that kids are being rushed into gender-affirming medical interventions, and so much confusion about puberty blockers and gender-affirming hormones. And people don't realize that the actual clinical guidelines for that are very involved. They include these long mental health evaluations before young people access any of these medications. It's really like a slow, thoughtful, thorough process that involves parents and endocrinologists and mental health professionals. But if you were to just be on Twitter or X or on some of these political platforms, it makes it sound like it's a very rushed, thoughtless process, which is just not the case. So my hope is that this book will get into more people's hands so they can better understand what this is really like, what the kids' lives are like, and also all the science and medicine that are important for these debates.
Yeah. What books should people read in addition to your book, or what information sources should people be using to get real information in an ongoing way? One of the things I've seen is that there's like an endless push of just ridiculous lies, non-science based misinformation. And so parents usually need a place to go to keep up with what's actually happening.
Yes, I would say be careful about trying to get your information from social media or trying to get your information, sadly, even from news websites, often are not really reflecting the best information that is out there. I would try and go to these really trustworthy places, like the American Academy of Pediatrics has a ton of resources on their website. The American Academy of Child and Adolescent Psychiatry, also a ton of evidence-based information reviewed by experts, written by experts. The American Psychiatric Association has a ton of information on their website also, and all of this is geared towards parents and the general public, and not in really dense jargon. So I would really try to stick to those kind of resources that are written by experts rather than by political pundits or politicians or journalists.
Exactly. And speaking of which, what do the lived experiences of trans youth and also of years and years and years and years of peer-reviewed science say about how to best support people as individuals and a community? What should people who are listening do?
Yeah, for trans kids, and this applies honestly to a lot of different types of kids, there are really three main things that we see protect their mental health. So one is having pride. So knowing other people like them, having role models. I put a lot of amazing trans people in my book so parents can know about them to tell their kids about, like Chase Strangio, a really successful lawyer who is trans, Rachel Levine, a really famous physician who is trans, Lily Wachowski, who made the Matrix movies. Really, no matter what your kid is interested in, there probably is an amazing trans role model in that thing. So pride is one. Community connectedness or knowing other kids like them. So if you can find a support group or a community center where they can have some community and know other people who are like them, extraordinarily helpful. And then the best predictor of good mental health outcomes for kids is family support. So just reminding your child that you love them no matter who they are, and that you're a safe place for them to come talk to about things, and that you're always going to support them is really what kind of every kid is dreaming of, and what queer kids in particular sadly often don't get, but can help them extraordinarily.
What do you think every elected leader should be doing right now?
Yeah, I would love for more of them to read on this topic. So sadly, I think there's been a lot of investment from the political right in talking about trans issues and building rhetoric around it and coming up with these catchphrases that make trans people seem scary. Sometimes even trying to make trans kids sound scary, which is so wild to imagine these little kids being scary, but they've been very effective. And there really has not been much investment from the political left to educate themselves as politicians to be out there talking about these things. So at risk of shamelessly plugging my book, I would love for more people to read resources like my book to learn what are these kids' lives really like? What is the science about conversion therapy? What is the science about gender-affirming medical interventions? What is the research that looks at the impact of like sports on trans kids? How many trans kids are actually playing sports? There's research that shows that policies that allow trans kids to use bathrooms that align with their gender identity are linked to lower odds of assault in bathrooms, right? There is actually all this science and data and information out there, but people just aren't reading and accessing it. So my hope is that people on the left will start to invest a little bit more in learning and then talking about it and getting the information out there.
Yeah, that's a big deal. For parents who are wondering where to go for like ongoing support, is the best person to go to their local physician, or where would you go locally?
Yeah, I would say in terms of getting clinical support, you can often start with your pediatrician. And if you have a child who's trans, I do think it's almost always useful to have a therapist that they can talk to, both about their gender, but also about how to live in a world that has a lot of stigma, right? So getting connected with a therapist who has some experience talking about these things with your kid is extraordinarily important. But also outside of clinical areas, having some personal supports. So if you can find a group where your kid can be with other kids like them is really important. And we also don't talk enough about how parents need support, right? So we know that the best predictor of trans kids doing well is if their parents can support them, but parents are up against a lot, right? People are stigmatizing their kid. Sometimes people are trying to blame them for their kid being trans or questioning their parenting. They're scared about their kid potentially having gender-affirming medical interventions. They're scared about their kid's future. All these very normal things that parents of trans kids go through. So finding a parent support group, having a therapist for yourself so that you can be at your best and have the support that you need so that you can support kids. And sorry, a long-winded answer, but on that note, there is another great book called Found in Transition by a pediatrician named Arias. She's a pediatrician who has a trans daughter, and she talked about her own experience of being a parent of a trans child. And it really goes through the most common challenges that parents face. And it's just a really lovely, validating book that I've found that parents find very helpful.
Love that. In this moment in time, we have a lot of children being used as political pawns. And what's your advice for parents in how to connect and engage in communities that are increasingly polarized?
Yeah, I think part of why the rhetoric against trans people has been so effective is because people don't meet trans people very often. If you know some trans people, you very quickly realize that they are just normal people like everyone else, right? These are normal kids trying to get through school. These are normal adults trying to live their lives. So kind of amplifying the stories of trans people, real trans people, is really helpful. I try and do that a lot in my book, both talking about kids and trans adults to put a human face to this topic. And also, again, kind of educating yourself on the science behind some of these political arguments people are having so that you can share that evidence-based information and science that should be informing these debates. That I think if all of us were to learn that, and every time somebody said something about trans people in sports or gender-affirming medical care, or this new awful idea that trans people are dangerous perpetrators of gun violence, which, by the way, is untrue. They're underrepresented among shooters, for instance. Right? If more people knew that data and were talking about it all the time, I think we would be in a very different place.
Yeah, for sure. Oh my gosh, it is such a stressful time. And in history, when you read the newspapers and when you see the terrible headlines again and again, you brought up, gun violence and the increase of gun violence in America right now as well. Do you have general kind of advice for people about how to talk against differences and really step forward with compassion and empathy instead of with judgmentalism and violence, for lack of a better word, looking at what we're looking at on the news headlines?
It's hard, but I will say the one thing we always think about as psychiatrists is that it's always important to come in with curiosity rather than judgment. And we all encounter things in our lives that make us scared or make us emotional. And we meet people who are different from how we are. And sometimes their differences can be scary or just something we feel like we don't understand or can't wrap our head around. But trying to remember to always come in and ask a person, why do you feel that way? Why is that your experience? I think can often bring people closer together, but we're not really in a very curious mindset lately. I think the way a lot of the media has been, especially social media, is it's very focused on fighting, right? Arguing, trying to convince the other person that you're right, trying to push your ideas and opinions, but trying to have more curiosity and understanding other people's perspectives, I think could move us in a good direction.
I agree. And I think one of the things about this moment in time is that sometimes people mistake uninformed curiosity for judgment, and also mistake sitting and listening for letting go of your moral compass. So in other words, that if you're not immediately front and center with, your opinion and what you think should happen, then maybe you're not listening to your moral compass. That makes it hard to have a conversation. So I don't know, do you have in this last couple minutes a couple of tips about how to let go of your judgment and listen?
Yes, it's really hard. This comes up in taking care of families of trans kids all the time is, you'll hear that phrase floating around the internet, that people think that someone like me who takes care of families of trans kids is going to sit down and say, do you want a live daughter or a dead son? Right? And these really intense statements that just shut down conversation so that I can't hear that person's perspective. When in reality is my patient is the kid, right? The trans kid is going through something really, really hard. And it's really easy to say the parent just needs to be accepting and on board with their gender, but that's not curious, right? That's not really listening to what the parent is experiencing. So I always take parents aside and say, listen, it's very normal to be scared about your child being trans. I want you to know you can say anything you want, and I'm not going to yell at you and say you're transphobic. I would rather you not say that in front of your child because I don't want your child to be hurt. But it's really important that all of your fears, what's making you uncomfortable, that we talk about all of that and get you to a place that is comfortable. So going in and kind of creating that safe space that people can word vomit whatever it is that they're worried about. Right, that's not me compromising my values. I'm not saying yes, you're right, your child is confused about their gender. But I do want to hear what you're worried about so that we can all come closer together, and hopefully so that I can facilitate a conversation between you and your child where you can express your worries and how you want to help, and your child can also explain their experience in a way that everyone can really hear each other.
It's so important right now across America to have this moment of listening to one another and compassion. Dr. Jack Turban, where can we find your book again? What's the name of the book again? Let's hear it.
Yes, it's called Free to Be, Understanding Kids and Gender Identity. hopefully in your local bookstore, but if not, it is on Amazon, Barnes and Noble. And there's a really great bookstore called Alstora, Allstora. That's a queer-owned bookstore online that has a lot of great resources too.
Thank you, thank you, thank you, Dr. Jack Turban. Thank you.
Thank you so much.
We're going to take a quick break, but stick around. We'll be right back with our next guest talking about the Women, Infant, Children Nutrition Program and how you can stop it from being sunset. We'll be back in a quick flash. Welcome back to Breaking Through with me, Kathryn Finkbeiner, powered by MomsRising. We are joined right now by a very special guest, Nell Menefee-Libey of the National WIC Association. Welcome, Nell.
Thank you so much for having me, Kristen.
I'm really glad that you're here to talk about a topic that I really wish we didn't have to talk about. First, could you tell our listeners what is WIC?
Sure. WIC is the nation's largest public health nutrition program. We serve about 7 million women, infants, and children nationwide during the really critical life stages of pregnancy and postpartum, and then birth through a kiddo's 5th birthday. WIC provides an evidence-based food package that is tailored to meet the specific nutritional needs of those life stages, as well as nutrition education for moms and young families. And WIC is also the nation's largest breastfeeding support and promotion program. So we do a lot to serve young families during this really critical life period.
WIC is a big deal. It's proven time and time again, not just to open avenues for families to get nutritious food that they need, but also to help the economy. A lot of people don't realize that. Can you share a little bit about how WIC helps the economy overall?
Yeah, absolutely. So in the most recent federal fiscal year, WIC was funded at a little north of $7 billion. It's about $7.5 billion. Most of that is what we call food funds, which just means they go directly into the program's food benefit. Those are benefits that families redeem at their local WIC authorized grocery stores for fruits and vegetables, for whole grains, for seafood, for baby food, for infant formula. All of the healthy foods that they need for their families, but that also means that those dollars go directly into local economy. Lots of WIC authorized grocery stores are small mom and pop retailers. And we know that WIC also goes a long way to support farms, the fruits and vegetable benefit. Those dollars eventually end up back in a farmer's pocket because they're the folks that grow those foods.
And who chooses what is available through WIC? What types of foods and how do they choose?
That's a great question. So that is determined by the Food and Nutrition Service at USDA, based in a comprehensive scientific review done by the National Academies of Sciences, Engineering, and Medicine. The last review was completed in 2017. That led to evidence-based updates to WIC food packages that were rolled out in 2024. So many states are in the process of implementing them, and I think you're actually in Washington, Kristen, which is one of the states that has rolled out all of the new WIC food packages. So some new options and more flexibilities for families to improve the WIC shopping experience. And those are reviewed every 10 years, but they really are grounded in the nutrition science as well as the specific nutritional needs of participants. If someone is lactose intolerant, their food package can be updated to make sure that they have access to lactose-free or to soy milk, for example.
It's so important. How many people are able to have the doors to opportunity open to them because they have access to WIC?
Yeah, right now, WIC serves about 6.9 million individuals across the country. The program serves about half of infants born in the United States. I think it's closer to 40%. But it is really a crucial step in building a healthier future for young kids in the United States.
Yeah, it's not a small number of people. You all, food prices are rising. Despite what we heard on some people's campaign trails, we actually seen prices of fruits and vegetables, for instance, are up 40%. So having programs like WIC really allows people to save healthcare costs, to be able to have kids healthy when they go to school, to, be in the labor force and put food on the table, even though often right now ends aren't able to meet just from one job. I mean, it's a pretty big deal that WIC is happening. What are some of the myths about WIC that you wish everybody knew weren't true?
That's a great question. I think WIC is often kind of a misunderstood or just it's a program that not enough people know about. Nationwide, even though we are serving about 7 million people, WIC only reaches a little more than half of those who are eligible. And one of the things that we hear from eligible non-participants, moms who are not enrolled in WIC, even though they are income eligible to do so, is that they fear their own participation might take a spot away from someone else. They think their neighbor might need it more than them, and so they hold back from enrolling in the program, even though they know it'll go a long way to supporting their family. We are quite fortunate that even though WIC is a discretionary program, that means Congress has to proactively fund it every fiscal year. There has been a bipartisan promise in place for almost 30 years to ensure that every eligible family who seeks WIC services can receive them. That is based on nothing more than a promise and a handshake deal. We are really fortunate that even in these challenging times, that bipartisan promise has been upheld. But I think it also is really crucial to building participant and community trust in the program. Folks need to know that they won't be turned away in a time of need. And right now, that's a promise that WIC is able to make to them that I'm really grateful for.
Yeah, me too. We are hearing reports that WIC is starting to increasingly be used as a political football, and that Republicans, even though there's been this long history of bipartisan support, because the data is overwhelmingly positive about WIC. WIC helps boost the economy, it helps boost families, it helps boost communities. WIC is just like good. It helps boost farmers. Small farmers are boosted by WIC, large farmers, all the things are good about WIC, right? So we've seen all the bipartisan support. And yet right now, as you know, again, the headlines are pretty bleak. We're seeing a breakdown of communication. How worried are you about the Republicans sort of stepping back from supporting WIC in the same way that they have in the past, and as they still should? We think everybody should support WIC, irregardless of political party.
Yeah, I think we're fortunate that there's no one who really outright says they don't support WIC. I would say the program is facing challenges because of the broader political environment. Like I said, Congress has to proactively appropriate the funds for the program every year, which means that when Congress doesn't do its job and pass spending bills, that puts WIC in a really tough spot. We are, at time of recording, a little more than 10 days out from the end of the fiscal year, and right now it's not clear whether Congress is going to be able to come together on a bipartisan basis and pass either a continuing resolution or appropriations bills. Those are really crucial for keeping the doors open and the lights on at WIC, and we really need Congress to do their job and provide families with this vital support.
100%. What can people do? Should they call their member of Congress? And if so, what should they say?
Absolutely. Please do call your member of Congress. You can tell them to fully fund WIC. That's what we call the promise that everybody who seeks WIC, who's eligible, can receive it. That's full funding. I think in particular, it's important to underscore that you don't want cuts to WIC's fruit and vegetable benefit, which is something that both the White House and some congressional Republicans have proposed in the past couple of years. You can also go to thewichub.com. That is the website run by the National WIC Association, and there will be a Take Action link in the upper right-hand corner. They'll take you right to a pre-filled out letter that you can send to your member of Congress. I will also say I promise somebody really reads those, because that used to be my job when I was a baby congressional staffer. So it really does matter to weigh in with your members of Congress and tell them to support this program.
100%. Also, if people are listening and they want to see if they can get access to WIC, to the foods in their own homes, how do they do that?
Yeah, absolutely. You can go to signupwic.com, and there will be a little field that you can fill in with some of your personal information, including your zip code. That will tell you where the closest WIC clinic is to you, and you can reach out to them directly. You can either go in person, or in some places you can even complete your initial certification by phone, which we know makes it a lot easier for, say, a working mom to participate in this vital program, because she doesn't have to take time off work. She can just call in over her lunch break and get connected to these really important nutrition benefits, breastfeeding services, nutrition education for her family.
That's great. Thank you. So I'm wondering, you care a lot about WIC. You've worked on WIC for a long time. And yet we're having some atypical political moments. We'll just call it that. What is bringing you hope and bringing you through this particular moment in history?
That is a great question. I will say in my personal life, one of my dear friends just had a baby. And even though I work all day, every day on improving the lives of moms and babies, this is the first time that one really close to me has been in my life. So I'm really excited about that. And I'm excited to keep doing this work with the WIC staff that we represent at the National WIC Association. I'm really privileged to get to work with them every day. They are wonderful people who make this program work. And I am really thankful for the work that they do.
What kind of differences have you seen WIC make in the lives of real, actual people?
Oh, that's a great question. So here's where I will admit that I don't have a history doing participant-facing work. I am mostly just the government relations person. But I can tell you that on the macro level, we have 50 years worth of evidence that WIC works in improving child health development outcomes, in improving maternal health outcomes, decreasing instances of things like low birth weight, improving rates of breastfeeding initiation and duration. But I do know from the conversations that I've had with WIC families in clinics when I've been fortunate enough to visit them, that WIC is a really vital support during what can be a challenging time for a young family. Having a new baby is really hard, and building these trusted relationships with WIC staff who know you, who know your kiddo, and who want the best for them can go a really long way. I think one thing that I often hear is that mom's first visit after baby is born is often not to her pediatrician, it's to the WIC clinic, because she knows that those are the folks who are going to be able to help her with breastfeeding if she's having trouble with that. Who'll be able to connect her to other vital services that she's eligible for, and who can also just be a listening ear, because a lot of them have been there before.
Yeah, that's so important. Community support of new parents is essential, including, as you said, emotionally and also with food. And I can't believe that access to safe, nutritious, healthy food is under attack.
Can I plug one of my very favorite WIC programs?
Yes.
So WIC has something called the Breastfeeding Peer Counselor Program, which is not available everywhere. We wish it was. But that is a program that allows WIC moms who have themselves breastfed to become peer lactation support counselors to support other WIC moms on their breastfeeding journey. That means that a new mom can be in touch with someone from her own community and talk about her own experience, provide peer-to-peer support. And we know that that is really effective at improving breastfeeding rates. It also obviously creates work for WIC moms, which we're excited about. This is one of my favorite programs that WIC has. And we are, again, grateful for the continued support from Congress that makes it possible.
Yes, everybody needs to call their member of Congress and say, support WIC, fund WIC, don't let WIC sunset. WIC is essential to our families, to our economy, to our futures. And it's time to open doors to opportunity, not close them. And can you give those websites again for
Yeah, absolutely.
Thank you so much.
You can go to signupwic.com to find out if you're eligible and find your local WIC clinic to get enrolled in the program. You can also go to thewichub.com to find a bunch of resources that we at the National WIC Association have put together to help advocate for the program. In the upper right-hand corner on that website, you'll see our Take Action link that'll send you directly to a pre-drafted letter to your member of Congress telling them to fully fund WIC, to support the fruit and vegetable benefit, to support the breastfeeding peer counselor program, and to continue to enable that longstanding bipartisan promise that every eligible mom who seeks WIC benefits can receive them.
Yes, yes, yes. That needs to happen immediately. So again, call your members of Congress, tell them support WIC. Make sure WIC is fully funded. Don't give up. You can call them, once a day until we get this thing fully funded again. It's so important, so essential for parents, for families, for our economy, and for our future. Thank you again.
Thanks, Kristen.
We're going to take a quick break, but don't go away. Next up, reproductive health care. Access is being rolled back, and we have tips on how to fight back to get it back. We'll be back in a quick flash. Welcome back to Breaking Through with me, Kathryn Finkbeiner, powered by MomsRising. We are joined right now by a spectacular, amazing, wonderful guest, Gina Arias of MomsRising. Welcome, Gina.
Thank you for having me.
I'm so glad you're on, but we're going to talk about a horrible topic, maternal health and access to reproductive health care. What is happening? There's a lot of headlines right now that are very confusing.
Yes, well, I want to talk about what's happening with Planned Parenthood. As you may or may not know, Planned Parenthood is our nation's largest reproductive health care provider. And right now, there are efforts to defund Planned Parenthood as part of Trump's One Big Beautiful Bill Act, or we call it otherwise in other parts. A provision was included to ban federal Medicaid payments to abortion providers that received more than $800 in Medicaid funds in 2023. A federal judge had initially blocked this measure, but now the appeals court overturned that block just last week. So basically, this new law eliminates patients' ability to use Medicaid as their insurance at Planned Parenthood health centers nationwide.
Wow. What impact is that going to have? That's a wow in the negative, listeners.
It is definitely a wow in the negative. Well, first, for the listeners, just to give some context, Medicaid is a program that's jointly funded by federal and state governments. Now, unless states have specifically put forth funding for abortion services, it's been illegal for years to use Medicaid to pay for abortion services, except in extremely rare circumstances. So, why are lawmakers and Trump doing this? Essentially, they want to cut off a key source of revenue from Planned Parenthood to punish them because where legal, Planned Parenthood health centers provide abortion care, and about 1/3 of all Planned Parenthood's income comes from public funds, and Medicaid is the biggest source. So really, it's part of a larger effort to restrict access to abortion across the country and essentially destroy our nation's reproductive health care infrastructure. So this will have a huge impact because there are 1.1 million patients who use Medicaid at Planned Parenthood. Just last year, there were more than 1.5 million visits to Planned Parenthood clinics from people who have Medicaid. And all of those visits, just the 1.5 million, were unrelated to abortion. Okay. Why is that? Because Planned Parenthood is a major source of other reproductive health care, contraception, cancer screenings, pregnancy tests, and treatment and testing for sexually transmitted infections. And these are all services that are typically covered by Medicaid. So if folks can't get those services, cancers will go undetected, STIs will go untreated. Keep in mind, chlamydia, syphilis, and gonorrhea, they're all infections that have become more prevalent recently. Patients won't get the birth control they need to plan their families and futures, and they won't get the abortion care that they need to plan their families and futures. And unfortunately, in several states, Planned Parenthood is the only option for abortion care.
Everybody should be able to choose if they're going to have children, and if so, when and how many. That is a standard that we have set in the United States of America that actually the majority of voters in the majority of places across political parties agree with. And it's not just me saying that. Poll after poll says that. And it's not just poll after poll and me saying that. It's also ballot measures. Every single time ballot measures related to access to abortion care have gone on the ballot recently. In red, blue, purple, all the states, they have always advanced, not restricted, access to abortion care. So we have some really loud, really vocal minority of elected leaders who are out of step with their own constituents. Their own constituents, generally speaking, want access to abortion care. What do you think it's going to take? What should we be doing? What should happen next, given that the restrictions are happening, even though people across political parties don't want these restrictions?
Well, before I say that, I do want to add that we know from the data that 6 out of 10 women who are getting abortions are already mothers. So this is a mom's issue as well. A lot of times there is this false narrative about who is getting abortions. So I just want to put that there. What can we do? Well, first, I just also want to mention that The people that are most going to be hurt by this are those who are already facing hurdles to get the care that they need, right? Folks who have low incomes, people who live in rural or medically underserved areas, Black and Latino communities, LGBTQ plus people. So what comes next? Well, first of all, Planned Parenthood's lawsuit against the unconstitutional reconciliation bill remains ongoing, even though this is now in effect. Planned Parenthood is continuing the work to fight against this in order to continue to serve patients across the country. And most recently, House and Senate Democrats introduced a proposed continuing resolution just last night that would keep the government open, repeal Medicaid cuts, and stop Planned Parenthood from being defunded. So, we need to support these efforts and continue to fight. Absolutely.
How do we support these efforts? Like, what should people who are listening do?
Well, people should let their legislators know, hey, defunding Planned Parenthood, these cuts to Medicaid are not things that are in our best interest. So fight against it. And if their particular representative is for it, let them know they are not for it. We have to continue to be vocal in these times. They are scary times, but we have to continue to raise our voices.
And if they're calling their member of Congress, what should they say?
Well, they should say that they know that the Medicaid cuts, as we all know, are a threat to our healthcare system, because even folks who don't have Medicaid, many of the institutions in their communities, especially, for example, rural hospitals, depend on these Medicaid dollars. And without them, they are at risk of closure. So, when we think about, and I'm just going to talk about rural communities for a moment, these folks are already dealing with having to travel hours to get medical care, especially women who are pregnant, because so many labor and delivery units have closed in rural hospitals. So traveling further, and this puts everyone at risk. This puts the person at risk, and this puts our healthcare system in a huge, I'd say, mess. It will get messier, these cuts. So we really have to stand up and say no to these Medicaid cuts, to repealing them. It's important.
Yeah, for sure. It's really hard right now. What's keeping you going and giving you hope?
That's a great question. I would say, my community and my family, and also history. I mean, I think it's important to study history. These sorts of efforts to oppress and to take away from those that need it most are nothing new under the sun, and people have always fought against efforts like this and authoritarianism. So we have to remember that, and we have to take strength from that, and learn from what people did in the past to fight back against these terrible sorts of things.
Yeah, for sure. When you're looking forward, is there any proactive legislation that you like that any elected leaders are pulling together? Or are there any elected leaders that we should be looking for their leadership in and looking for them to pull legislation together soon?
Cut. Kristen, I don't know anything about that.
Oh, okay. Eric?
Sorry, but I do want to
Got it.
talk about
Wait, about.
the whole burning of the contraception that's going.
Oh, yes. Okay. Eric, do you have that?
Yep.
Right now, we have people who need contraception, and yet under Donald Trump's leadership, it would appear that contraception is being burned. Can you tell us a little bit about that?
Well, there is a plan right now to burn $9.7 million worth of U.S. taxpayer-funded contraception. This is contraception that was originally intended for women in low-income countries, and it is all sitting in a warehouse in Belgium. I'm talking about IUDs, implants, pills, injectables. These contraceptives, excuse me, have already been paid for and they are not expired. But the Trump administration has decided that they don't want to disperse these supplies, and instead they want to burn them. They want to incinerate them. So just for context, again, this is part of the administration's larger work to dismantle USAID, which stands for the U.S. Agency for International Development, which effectively has ceased operations. But it was, since 1961, the primary U.S. government agency for managing international humanitarian and development assistance. So this is what they want to do. They want to burn all of these perfectly good contraceptives. And this is a plan that they have, despite the fact that there have been many offers from different organizations to buy the contraception from the US government. So, the contraceptives are sitting there in a warehouse. They have been for months. Planned Parenthood led a group of 77 organizations, including MomsRising, sending a letter to Marco Rubio condemning this decision. And most recently, there were definitely protests that broke out at the U.S. Embassy in Brussels with people voicing their objection to the planned incineration.
It's ridiculous. I cannot believe that important and much needed medical supplies are being put under threat of incineration by the Trump administration. Literally can't believe it. Can you believe it?
It's ludicrous.
Yeah, ludicrous is one word for it. Before we let people go, we only have just about a minute and a half left. Do you have advice for listeners who are paying attention, staying involved, and just really, really, really getting worried, cynical, and scared that their voice might not matter anymore?
Well, I would say that is patently false. Our voice always matters. And to continue to speak up, speak out. There are demonstrations that happen as well, like get linked into what is happening in your community and pushing back, because without these voices, without community voices, these folks who are doing all of these things will think that they have free reign to do so and that people are supportive. So continuing to speak with our legislators and also join with other community members and organizations in our local areas to show up and show out.
Yeah, for sure. And if people want something to do, if they're worried and they're like, hey, I don't know what to do, you can always go to momsrising.org and find actions and information and even share your story. And for people who are listening, stories are powerful. When you share your story, you help other people know you're not alone. You give elected leaders who may not have a little bit of a clue about what's really going on. And then you let the media know what's going on as well in the real lives of real people across the country. Thank you so much for being on, Gina. Thank you for all you do. Really appreciate all your leadership and you spending time with us to explain what's happening.
My pleasure. Thank you.
Thank you. Well, that's it for our show today. Thanks so much for tuning in as we tackle the top topics facing our nation in a way that requires the most boring disclaimer in the history of the planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to Moms Rising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week.